Oh, good. You can see me and hear me. All right. I'll put my slides on. Okay. So I'm Dr. Lauri Brouwer. I work at Living Wellness Medical Center in Phoenix, Arizona, and I want to discuss lab testing today. Why you want to do lab testing, what testing you want to do, and what kind of frequency you should do these tests. Um, so why are we doing lab testing? Because knowledge is power. Having more knowledge about what's happening within our bodies helps us to better change our habits and take care of ourselves well. What doctors, naturopathic medicine can do for you is really to function as a teacher, right? We're going to help you to learn about your body. So we'll listen to you, listen to your concerns, your questions. We're going to ask you lots of questions too. We're going to do some troubleshooting, try and do some investigating to what may be the root cause of the main problems you're having, or just look at your general health to make sure that you're still on a good track. Even if you're not feeling symptomatic, we want to make sure to still check in and make sure things are running smoothly in the background. Of course, we use labs to diagnose underlying conditions, but really that's a big part of what we do is finding out the root cause of your problems, right? That's what naturopathic medicine is best at. And so once we know what's happening within your body, we can help guide you on treatments that are going to give you the outcomes you're looking for. All right. There's one thing I want to make really clear when I talk about lab tests is the reference range is the normal range, right? And that generally was set, decades ago. They mostly tested men and young men to do these sorts of tests. So not all of the reference ranges are really valid for everybody. Depending on what time of life, what health condition you're in, that reference range might not actually reflect a true state of health for you. There's optimal function, and that's what we're looking for as naturopathic doctors. We want to help prevent disease and foster optimal health. So we're going to be looking at the values a little differently when we review labs with you. We are always going to look at preventing disease, so we're going to look for little changes away from normal range that indicate that there may be a problem, in the future, and we're going to prevent that, right? Basic labs, these are the ones that you're going to want to have done once or twice a year. At minimum, once a year is a good time to do this. But if you have a health concern or you're working on something actively, twice a year, or even more frequently than that. The basic labs I'm going to talk about generally are covered by insurance, but all of this depends on your plan. If you have health insurance, you need to check with your plan to see what's covered. But mostly basic labs are going to be in that category. Those things include your CBC and your CMP. Complete blood cell count, that CBC test. Why do we look at that? Why do we look at your blood cells? Because we want to see if those red blood cells are indicating that there's anemia, which can cause, fatigue and dysfunction. So we want to look at red blood cells. Your white blood cells can tell us about your immune system, whether it's functioning well, whether it's overreactive, like in the case of allergies. And we look at the platelets, which help with clotting. So complete blood cell count looks at those things. The metabolic panel checks quite a few more things. We're going to always want to look at your blood sugar level to see how your metabolism is handling that blood glucose. We can test to see if your kidneys are functioning well through the tests that are listed there, GFR, BUN, and creatinine. We're going to look at your electrolytes, which is something your kidneys generally manage, the balance of electrolytes. So we'll look at those. Also minerals. Again, those are mainly managed by your kidneys. The proteins that we look for are proteins that are synthesized or made by your liver. So this is kind of a way of saying, how is your body functioning with creating those proteins? Liver enzymes is also a direct way of kind of seeing if your liver is having any sort of damage. If you have, high exposure to different toxic elements, you may be stressing or overstressing your liver. So we're looking to see if there's any evidence of damage through that test. And same thing, gallbladder associated with your liver, we're looking there to see if there's any issues. So basic tests can tell us really about some major problems that may be upcoming can be found through that testing. Other tests that we can do outside of what's just the standard. So the first two I talked about, CBC and CMP, that's what most any doctor is going to run at pretty much any visit or anytime they run labs. There are other tests that we can do that are still considered, basic function tests, but they're not generally ordered unless, we're trying to check a little deeper into something. But for men, we always want to do the PSA, prostate marker, just to look to see if there's any inflammation in a male prostate. GGT is one. It's another liver enzyme. So on the previous slide, I mentioned that we looked at some liver enzymes to see if there's evidence of damage. This GGT enzyme is one that if there's more, again, just impact from toxins, if you have a high toxin intake or exposure, drink more alcohol, recreational drugs, smoking, even high sugar consumption is damaging to the liver in a specific way that shows up by having high GGT. So we can look at that if we feel that there's a need to look further for liver damage. Uric acid is something that's high when people have gout, but it's not really completely specific for that reason, but we can test that to see if you've got a high uric acid level. The rest of these, the ESR, CRP, and CRP high sensitivity, those all measure inflammation in your body. Some of them are more acute or, instant, inflammation, and some of them are speak more about chronic inflammation. The CRP high sensitivity is specific to blood vessels in the heart and brain. So that one is important if we're evaluating you, if you have a high risk for cardiovascular disease, heart attacks, strokes, things like that. Then we're going to look more closely at the inflammation within your blood vessels, because that's really where it starts. Other basic labs, again, these are things that are generally covered by insurance. They're pretty routine. Hormone levels. Now, for our office, it's very routine to measure hormone levels because we all specialize in managing hormones and doing hormone replacement therapy. So the way that we do hormone testing in this office is through blood testing. I know there are some companies out there that offer saliva testing, but I personally don't rely on those or use them because the studies that I follow for my guidance on doing hormone replacement therapy are studies that only utilize blood testing for their measurement. So their evaluation gives us the guidance on what specific blood levels we want. And you can't correlate that to a saliva sample or a urine sample. So I don't measure most hormones in any way other than blood. There's one caveat to that, and we'll get to that later with specialty testing. But we're going to do testing through blood tests for your hormones. Some of those that we'll check on everyone will be thyroid and adrenal. And for males and females that are, aging and want aging support with hormones, are definitely going to check them for testosterone, for women, estrogen, progesterone as well. We want to look at insulin. That's a really important hormone to understand how it's working in your body, because that's the hormone that controls your blood sugar. So we want to make sure your body always stays very sensitive to insulin, and that your body only requires a little bit of insulin to get the job done of keeping your blood sugar under control. So insulin is an important one that we can add into basic labs. Vitamin D, yes, we call it a vitamin, but folate calciferol is the name of the compound itself. It's a prohormone that's made in our skin and then further changed in our kidneys and our liver. And it's not a vitamin per se, it's a hormone that we want to track. And that one is very important for bone mineralization. That's one thing that we know that it's important for. That's why they add vitamin D to fortified milk, is with low vitamin D, children get rickets. And adults will get something called osteomalacia, and that's because of having too low a vitamin D to keep calcium moving into your bones. We want to make sure your level is up. Also, we now know what level your vitamin D needs to be at to optimize your immune function, because vitamin D also stimulates your immune function, in particular, the part of your immunity that fights viruses. So during the COVID times, we've learned a lot more about vitamin D and how it plays a role in immunity. And we know what levels you need to have to keep your body fighting viruses really efficiently. So that's one to add into your basic labs. Of course, there are others, but these are the hormones I want to highlight. Heart disease screening. Really important for anyone, especially, as you're aging over 40, you should really be looking into this. But if you've got a family history, again, of heart disease, heart attacks, strokes, things like that, we'll want to really take a close look at your cholesterol. This basic lab isn't the best way to look at cholesterol, but we can at least get some guidance by doing a basic cholesterol panel. What is testing for is lipids, which are just fat molecules that transmit through the bloodstream. The different types are cholesterol, including high density, low density, and very low density cholesterol, then triglycerides, and the ratio of cholesterols can also give us information. So this is just your basic one. It needs to be done fasting. So you usually would do this with your fasting labs looking at blood sugar too. So let me talk about specialty labs, because like I said, that cholesterol panel, that old-fashioned basic one, doesn't really give us a thorough picture of what your risk for cardiovascular disease is. So we've got specialty labs that give more information. Let me backtrack one second. The previous labs that I talked about, all your basic labs, your CBC, your CMP, maybe your PSA if you're a man, hormone labs, all that, we should do a minimum of once a year. Better to do them every 6 months so we can catch things if they're starting to change or progress and move in a wrong direction. Specialty labs are going to be just up to the discretion of the doctor to let you know how often to do them. The specialty labs, for the most part, aren't covered by insurance plans. There are a couple that are, but for the most part, they're not. So you'll want to know the pricing of that before you commit to it. We'll always quote you the pricing here in the office so you know how much these specialty labs will be. They're to diagnose a problem, to investigate the cause of a problem, diagnose it, and then as we monitor progress, we may need to repeat these. Let's talk about some of these labs. Heart disease screening. So right on the tails of that other cholesterol panel I told you wasn't so helpful. The advanced lipoprotein profile can tell us a lot more about what your risk is for developing heart disease. It measures the size and the density of the cholesterol particles, because the LDL particles usually are the ones that get the bad reputation for being harmful to our blood vessels and our cardiovascular system. But it's not just how many LDL particles you have, but what their size is and what their density is makes a difference. The smaller ones, I liken them to like a golf ball, right? They're dense, they're hard, where the ones that would be big and fat and fluffy, like a beach ball, like that LDL wouldn't be harmful, but the small, dense ones can cause damage to your blood vessels. So we want to measure not only how much LDL you have, but what do they look like? That gives us a much more true evaluation of your risk. Then some other testing that we do that's specialty testing that's for females specifically is Candida. Women tend to have problems with Candida. It affects us more strongly. So we can do Candida testing. Things that would promote an overgrowth of Candida in the vagina would be, the use of antibiotics. I think any woman who's taken antibiotics has been made aware that this can cause a yeast overgrowth in their vagina. So antibiotics can cause it, but also, a high sugar intake promotes Candida growth, certain medications that you might be prescribed, illnesses. And then if you have diabetes, that's also something that definitely promotes Candida growth. So we can test you to see if you've got a problem with Candida. We can also test for any other vaginal irritation problems you may have, because oftentimes women will think, oh, I've got a yeast infection, I've got a yeast overgrowth, when actually they have something going on with, too much bacteria overgrowing. And so we want to really find out what it is that's causing irritation to a vagina, not just assume that it's Candida. So we can do advanced testing to test for the causes of bacterial or other yeast kind of overgrowths, as well as herpes. Then, of course, Pap smear. Most women are getting these routinely, and we can follow up on any kind of abnormal PAPs. We want to look at your HPV tests, whether you have HPV and what types, because some are nuisance and some actually can progress to causing cancer. So we want to make sure to test for female health concerns specifically. I said before that we really tend to want to do the hormone testing using blood samples because that's the most valid way that we know of. But when we're talking about doing adrenal hormone testing, it can be pretty tricky to get that hormone tested correctly because it varies throughout the day. The output of our cortisol and DHEA, which are adrenal hormones, varies throughout the day with our stress level, with our our body, the environment our body is in. So in order to be more comprehensive and thorough and get a good sample, we don't just test once during the day. We would test at 4 periods in the day. And this one, we do have good data showing that saliva contains measurable, valid amounts, of these hormones. So we can do specialty testing, and we send you home with the kit. You collect the saliva at home and send that off to the lab. Adrenal hormones are really important to track and to know what's going on because we live in a world that our primitive human bodies were just not developed to live in. We have light at all times of day. We don't have sleep-wake cycles that are guided by light cues anymore. We drive through traffic and we encounter so many other humans, and that's actually threatening to the human animal to be surrounded by other people all of the time. And our bodies are just generally more stressed out now than they've ever been in the past. So the changes that can happen to your physiology with prolonged or high stress levels, it really can change your neurotransmitters, your hormone production. It can change your insulin sensitivity. So we want to make sure we stay on top of your adrenal health. And this saliva testing in a 24-hour period is the best way to look at that. This is an example of a test that tests just for that. And you can see on where there's the green stripe there, that little graphic, the normal output of our adrenals to output cortisol specifically, it should be high in the morning and then drop very low at night. And so this sort of testing shows us if that pattern is preserved, that natural circadian rhythm, or if yours is off kilter in some way. So we can, again, get to the root cause of what may be causing you fatigue or allergies or excess inflammation, autoimmune problems. We can get information from this testing. Another really favorite test around here is nutritional status. We like to do micronutrient panels because it allows you to stay on top of your nutritional status and not wait until you have a deficiency that's causing you illness or symptoms. So be proactive, not reactive. There are many nutrients that are vital for keeping our processes working, keeping all of the functions of our body working well. And again, in a stressed out world, in a stressed out body, we use more nutrients. We use up our B vitamins. We use vitamin C more to manage the stress. So we want to be able to check if you are getting adequate nutrients from your diet. And if you need to make modifications to your diet or add supplements, this is the kind of testing that can help. This one, I really love this test because it's not just about your vitamins and minerals, but it looks at your antioxidants, which help protect us from cancer. It looks at your amino acids, which are precursors to neurotransmitters that manage our mood, and other metabolites. So I love this test, and I highly recommend it to anybody. Whether you think you've got a good diet or an iffy diet, this is a great way to know for sure. This is a little graphic from some of that testing. Just showing the different nutrients that are listed, and you can see how they present the information. If you're all good to go, it's green. If it's a problematic level, it's going to be tested, or it's going to represent it as red. Also, the different ones that come up, if your testing shows something that's you have a deficiency, then you'll get more information about that particular vitamin, what it does for you, how your body can run out of it, how it gets depleted, and what sources you can get it from. So I like to do this test, and I also really do like to sit down with patients and go through the results with them, because even though it gives you these graphics that say, potential supplement you can take, this is a neutral informational sheet. It doesn't take into account your particular situation. So rather than just going on the guidance of, this test result sheet, I like to sit down and talk to my patients about how they can get the best nutrition possible. All right, speaking of nutrition, digestive system function, really important to be able to absorb nutrients. You have to have a good digestive system function. We have a test that can be sent home with you. Again, it's a kit that we would give you. You collect your samples at home, send it into the lab, and the comprehensive stool analysis is really fantastic for looking at gut functioning. If you have a low population of good gut bacteria, or you've got too many bad gut bugs in there, this will give us that information. If you've got inflammation within your gut, it'll show up on this testing. If you're not digesting foods efficiently, it shows up on this testing. So it's a really fantastic comprehensive test. And if you've ever worked with a naturopathic doctor, I'm certain you have heard and been told again and again that our gut is the determinant of our overall health. If we don't have a healthy, well-functioning gut, we're not going to be generally healthy. Our resilience will be low. Our gut is intricately tied to our brain and our moods and our emotional control. And so we want to make sure that your gut health is good and it's not contributing to anxiety or depression. But also it goes the other way. If we're having, problems with moods, that can affect our gut and create damage there. So we want to be able to evaluate this system. This is a great way to do it. This is an example, again, of what some test results look like from the company we use to do our comprehensive stool analysis. It shows here the green and yellow and pink, red columns. That is giving you that if you want to see these bacteria, they show up in green. If it's a yellow, it's a round, it doesn't necessarily cause you harm. It's just one that's kind of hanging in there. And then in the pink column is dysbiotic, obviously things that are harmful. So we can measure all of these things and get the breakdown about it by doing this test. This is great if you've got any digestive dysfunction going on, bloating, gas, flatulence, burping, or pain. All right. Beyond the stool analysis, which really can give us a lot of terrific information, there's another test that's specialized just for if we feel like the problem with your digestive system is because of your small intestine. So the small intestinal bowel overgrowth or bacterial overgrowth is something that we're seeing a lot more of recently. It's become much more common, much more prevalent. Again, stress impacts our bowel function. Any kind of surgeries that you may have had in your pelvis or abdominal area can interfere with your bowels, can lead to problems. So, and also, if you're chronically constipated, that can lead to this problem. If you've had food poisoning events, that can lead to this problem. So there are a lot of things that can impact your small intestine. And this is really the best way to test for that. The best way that's non-invasive. There's other testing and things that can be done that require, tubes going down your throat and getting biopsies and samples and things. But this is a really non-invasive way to look at the health of your small intestine. And it's a pretty simple test to do, but it does take some preparation. And you'll want, the guidance from your doctor on how to do this test. But this one is really helpful if you're somebody who has bloating, especially bloating that occurs before even the end of your meal. If you get abdominal bloating or gassiness and it doesn't hit you until around bedtime or late into the night, fine. But if you're eating and getting bloated and having to loosen your waistband before you end the meal, that sort of bloating is probably happening within your small intestine, and that's problematic. It can interfere with your digestion of nutrients. It can cause a lot of problems. So this is a really great test. Again, often not covered by insurance, but worth the cost because it gives us a lot of info. This is what that test result would look like. If you can see down at the bottom, there's that graph, and it's got the lines that curve up into an arc. In this particular test, we do see evidence of excessive gas production close to a mealtime. And so this would be a positive result for somebody with SIBO, or small intestinal bowel overgrowth. So that one, that's just what that test looks like. And of course, I would interpret that, or one of the doctors here would interpret that for you at a follow-up visit. All right. Other things that can go awry with our digestive system, people can develop food sensitivities. This is different than food allergies. Food allergies happen immediately. Think of somebody who eats a strawberry and then their throat closes up. That's an allergy, an immediate response. Food sensitivities, they take longer to get the symptom after consuming the food. This could be something where you eat a food that your body's your immune system is reactive to, but 2 days later you get a stuffy nose. And people never put that correlation together, right? I ate this food and 2 days later I have a symptom of, a runny nose or congestion or wheezing or something, that you think maybe I'm getting a cold. So this is a really fantastic test to look for what foods might be causing you irritation. But there are tests on the market now. I just want to highlight this point. There are tests available that you can just buy over the counter, order online. They'll send you the test kit, you do it at home, and then they send you the results directly. But evaluation of those results isn't as straightforward as, don't eat that food anymore. Because yes, for a time, if your body's reactive to a food, you have to pull that food out of your diet, but that's not the end of the story. That's not treating the root cause. That's just stopping the symptom of the irritation. We want to find out, if you are sensitive to multiple foods, why? Why is your body reacting that way? What's gone wrong in your digestive function? So I just would caution you to be wary of doing food sensitivity tests that you can purchase and not be evaluated by a doctor, because it's a really simplistic test that doesn't treat your underlying causes. But if you do this testing with your doctor, that's what you're going to get from us, is the thorough evaluation and a plan of action. This is, again, here's a result of some of the foods that are tested for in a basic panel. We have different panels that can test a variety of different foods. Some test, 96 foods, and some are, I think, 172. It just depends on how many foods we need to look at to capture what your body might react to. But they're broken down really easy to understand in different food categories, and also the amount of inflammation or the amount of immune response is highlighted in numbers like 0, 1, 2, 3. So you can also see the intensity of your body's reaction to certain foods. So this is a really great test. Again, have it evaluated by a doctor. So again, I'll just wrap back around to this: knowledge is power. This is why we do our testing. To achieve and maintain optimal health, right? You need to make informed decisions. And you do that, you get that information from doing proper testing. The doctors here at our office are ready and willing and able to help you with ordering the testing, with evaluating the testing, and with regular checkups and testing yourself frequently, a couple times a year, just making sure everything's on track. You're creating a relationship with your body. You're showing your body that you value it and that you're caring for it and not letting things slip over until you feel lousy and then you need to run for help. Keeping your optimal function every day is what we're aiming for with all this testing. Okay, I'm going to go ahead and open up to see if there are any questions that anybody's got in the chat. All right. I'm not seeing questions popping up here. So I'm going to go ahead and just end it there. And let me stop the slideshow. Okay. So thanks again for joining me today to learn about lab tests and which ones you want to do and why, and what specialty tests you might want to do. So please reach out to the office if you want to know more about the testing or get started on your own process. All right. Thanks.